officially welcome you to our webinar tonight, which is about the role of nutrition in rheumatic disease. And children and eating is a source of anxiety and stress for every single parent I know. And we know that gets extra complicated when you factor in a health condition like juvenile arthritis, lupus, and other rheumatic diseases. And as we know, it's not just about maintaining a healthy diet, but also managing side effects from medications, encouraging healthy eating during a flare, and so many other factors. So we are really excited to have you here tonight. And who that you is, just so you know, is over 71 cities in Canada are represented tonight, as well as 6 countries around the world. So that's a really great indication of how popular this topic is and how much misinformation out there exists. And so we just wanted to start the webinar by encouraging everyone to introduce yourselves in the chat box. You'll find that on the bottom bar of your Zoom screen. And I would encourage you just to tell us your name, maybe where you're watching from. You can include some information on the age of your child and diagnosis, but also let's share what's on our plate tonight or what our favorite food to eat is. And that's a really nice way to start connecting with other families who are on this webinar tonight. We have over 120 participants this evening. So before we begin, I also just wanted to share a little bit about who Cassie and Friends is for those of you who are new to our virtual education series and our organization. So everything Cassie and Friends does towards our mission of transforming the lives of kids and families affected by juvenile arthritis and other rheumatic disease is done in partnership with affected youth, their parents, family members, and their healthcare teams. So what that looks like in Canada is we have amazing relationships where we talk back and forth with all 14 major children's hospital pediatric rheumatology teams across Canada and work with them really to understand not only the needs of their local center and the families that they serve, but also to try and connect this community right across Canada to speak in one loud, impactful voice about the need for more resources, more research, and more awareness for this community. And that's what we work on every day with a focus 100% on kids. Before we get started with the webinar, I just have a couple housekeeping items and slides. And most importantly is we would like to thank our sponsors. This webinar and virtual education series, this is the second one we've done in 2021, would not be possible without our sponsors. And those are Nicola Wealth, AbbVie, Amgen, Roche, and Sobi Canada. As I mentioned, this is not our first webinar. So we are so excited to be offering these webinars on a monthly basis to provide information to youth and families. And if you go to our website, cassieandfriends.ca, what you're going to find is a whole series of recordings of our past sessions. So you can always watch those on a variety of topics. But we've also indexed all of the questions and answers that have come out of those sessions. So we get questions submitted beforehand. We have live questions during the Q&A. And what we've done is created an incredible resource of medical and evidence-based information for a variety of topics as you and your child and family journey through your specific rheumatic disease. So I mentioned a live Q&A, and that's, I think, just one of the most special parts of these webinars is that we're not just bringing information to you, but really inviting a dialogue and allowing you a chance to talk to our patient and family speakers when they're available, and also to the experts. And so I know I encouraged everyone to use the chat box down below, which is excellent. I see people are in there, but there's another button down below which says Q&A. So if during the session you have a question, you can pop it in that Q&A box. And then when we start the live Q&A, you can continue to use that spot. We also have all of the questions that were submitted through registration. So really, really encourage you, use this time, ask your questions. We know that that's not always possible in clinic and in your children's appointments. So this is really a special time to dig deep into the sort of questions and topics that are important to you. We're also really, really excited to have a safe, secure online support network for parents. So this is a little bit different than, say, a Facebook group where there's maybe redirected ads or it's not as private, but this is just an app you can download on your phone through a specific health network company. And what we do is we ensure that you're going to go on there and you're going to connect with other parents. You're going to be able to ask questions. It could be today to keep the conversation going, or anytime you have a question. We always say that, obviously we have expert speakers here, which are from the medical field, but we know that some of the experts that families need to speak to are just other families to understand how they've navigated things, what their experience was, and also just to feel that sense of connection. So we encourage you to go to cassieandfriends.ca/support network, or just use the QR code on the screen, which will take you either on your Android phone or your iPhone to download. It's called the Curatio app, and then you can access that Cassie and Friends network. Okay, so finally, we are here to our guest speaker. So we know, again, that eating and children is a source of anxiety for so many parents. It's also extra complicated when you factor in a health condition like juvenile arthritis. Before we get started, we wanted to mention that one of the things that we've been so proud about and are very excited to include in our webinars is a patient and family speaker. And you'll notice tonight there's only one speaker here on this session, and you might be wondering why we chose to do that. As you know, there are endless opinions on nutrition, and there are also so many factors that go into you, your child, your family, and what and how and all the ways you choose to integrate healthy eating into your lives. And we just really felt that no specific patient or family story could speak to that universally. And also, given that we have the most registrants we've ever had for a webinar, we really feel that people are here for information, evidence-based information, like what are the facts. So we're really excited to have Inez Martincevic here to provide us that information. And Inez is a clinical dietitian at the Hospital for Sick Children. And we actually first heard about Inez after she presented at the Canadian Rheumatology Association conference, which is for healthcare professionals. And after that conference, we heard from so many nurses and pediatric rheumatologists across Canada who told us this is the speaker that you need to answer families' questions that we're not getting to in clinic or that we don't know how to answer. And when Inez came and spoke at one of our Family Day conferences in Vancouver, we really saw what they meant. She is so approachable, so knowledgeable, and parents were lined up after that session to pick her brain about all their questions about nutrition and their children, and how what we do know and what we can do to make a difference. When we asked Inez what her favorite foods were, she answered mixed berries and avocado. And we're like, okay, I don't know if we can live up to that standard. But then she added that she also really loves a good hunk of bread dipped in olive oil and balsamic. So we were quite pleased about that. And I'm very, very excited to now welcome Inez.
Thank you very much, Jennifer, and to everyone at Cassie and Friends for inviting me to chat with everyone in the audience this evening about nutrition and the role of nutrition in rheumatic conditions. So we are switching screens right now. So I'm going to share my screen with everyone, and fingers crossed it works. Wonderful. Okay, so today or tonight, depending on what time zone or part of the world you're in, we're going to review the knowledge that we know about diets and nutrition for treating arthritis and some other rheumatic conditions, but also chat a bit about healthy eating for the entire family. And I am super excited to get started on some of those nutrition topics. But I think before we dive in, I would really like to make sure that we're all on the same page with respect to some information about rheumatic conditions and some terminology. This is based on some feedback that I received from the last opportunity I had with Cassie and friends. So I really wanted to make sure we're all on the same page. As Jennifer mentioned, there are many rheumatic conditions out there. Some of them a bit more common, like juvenile arthritis and lupus. Some of them a bit more rare, like juvenile dermatomyositis or Behçet's. And while we really don't know what causes these conditions, why they happen in children and adults, I just wanted everyone to know that what's thought right now in the rheumatology community is that it's a very complex, complicated interplay of your genes, your immune system, and how your immune system responds to the environment. All right. And the environment is a big, large word, and it encompasses a lot of things. And underneath that umbrella of the environment, and what we'll be focusing on tonight, is nutrition and food. In addition to some other kind of sort of understanding of background information is there is no known cure for any rheumatic condition. So it's your rheumatology team's goal to treat the condition. And I'm going to be using that word treat a lot during tonight's session. And so I wanted to make sure everyone knew what I meant by the word treat, because sometimes there's different nutrition goals that are out there, either for your child or yourself if you're affected by a rheumatic condition. And to make things even more confusing, we sometimes use different words to mean the same thing. So we might say treatment, therapy, management, care plan, intervention. But really what your care team, your healthcare team is implying is this recipe for treatment, as I like to term it. Okay. And so many rheumatic conditions are autoimmune, meaning the immune system is involved, and often it results in inflammation. So they're autoimmune, inflammatory conditions. And so the primary goal from your rheumatology team in treating the condition is to reduce the disease activity as well as the associated symptoms. So in the case of disease activity where there's inflammation, it's to reduce, to get on top of that inflammation. While balancing with that goal, you're trying to prevent side effects. And I don't just mean side effects from medications necessarily, but side effects from chronic, meaning for a long time, daily, long time, sort of side effects of what can occur with inflammation. So things like joint damage if you have arthritis, or changes to your skin if your skin is affected by a rheumatic condition. All at the same time trying to improve quality of life. So factoring in things like what a child might be missing, like school or sports, when they are affected by a condition. All right. Um, and the reason why all of that is important in tonight's talk, and I will not at all be going into any details of these diagrams. I certainly won't do them any justice like the experts who are researching the role of diet and nutrients and foods and ingredients in rheumatic conditions. But really, these pictures are here to highlight just how complex and complicated it is. You know, on the right-hand side, there's a figure there of a knee joint, and it's talking about all of the different immune-mediated pathways that might be triggered and all the environmental factors that might be impacting it. You've got other figures looking at the role of table salt or sodium on all these different types of immune cells, things like B cells or macrophages. And then you've got another figure looking at anything that you might have in your diet, like omega 3s or coffee that we're exposed to, all of us every day. So it's really to say that it's complicated, and this is why we need to do more research to understand the role better and provide you all with clearer recommendations. The other thing that I wanted to mention, and I think it's an important message tonight, is that your rheumatology team hears you. You know, we're aware that many families and caregivers of children and teens and family members that are affected by rheumatic conditions, you know, they're interested in complementary alternative medicine intervention. So things like supplements and diets, particularly in autoimmune inflammatory conditions, things like arthritis, inflammatory bowel disease. You know, we also know that individuals that have been affected by rheumatic conditions, they have reported that diet actually plays a role in their symptoms, either worsening their symptoms, things like joint pain or joint stiffness or sleep, but also you know, negatively affecting them. So both symptom improvement, but also symptom exacerbation. You know, and we also know that many families and caregivers have actually tried dietary interventions. This study that was recently completed surveyed families of children who are affected by arthritis, and it was found that a third of all survey respondents actually did try a diet therapy for the condition, and about 50% of those that surveyed that they did try a diet said that there was an improvement to symptoms. You know, so there's a huge interest out there, and we're all aware of it, but we're trying to balance the information that's out there with making sure that it's ideal, optimal, and actually safe and effective at treating your child or your condition. And so, how do we go about doing that? Well, epidemiologists or researchers that are interested in understanding why a condition develops and how it develops start looking at trends as we start to learn about a certain condition and the numbers unfortunately grow. We can start developing some associations. Now, full disclosure, most of the epidemiological research that's been done to date around the role of diet and nutrition really has mostly been done with adults, and it also has primarily been done in arthritis. So I say that because the evidence out there for childhood diseases and rare childhood rheumatic conditions is really very limiting. But that doesn't take away from the message, which is what have we learned? Well, we have learned that individuals are at a lower risk of developing arthritis if they eat a diet that's rich in fruits, rich in vegetables, has a lot of whole grains in it, has good sources of omega 3s like fatty fish, you know, things like the Mediterranean diet. And for those of you who are adults out there, maybe that are listening, there is some evidence out there that red wine can actually be beneficial, but in moderation, of course. You know, and why is this information important? Is it lends itself to creating studies that can then look at, well, what kind of diet would there be for individuals with rheumatic conditions, and help shape to form the research that can be done to study that. Okay, and this is a very busy table, information which will be shared through Cassie and Friends. But the reason that I put it up is because I wanted to highlight that in the last 20 years, there's actually been a lot more research in this area and emerging evidence that's out there. So it's really exciting to think what can happen in the next 10 years, you know. And one of the trends that I'd like to highlight through these publications that have actually reviewed the studies that have looked at whether diet can treat a rheumatic condition is is that there's more and more info out there. So what started with things like using omega-3 supplements has now over the years emerged into a better kind of sort of understanding that, you know what, diet might really play a role. And it's more than just one food or one ingredient, but likely that it's complementary. And the reason why there's a little bit of a green highlighted comment there for everyone is to say that in addition to autoimmune inflammatory conditions involving the immune system, there's an interest in the role of microbiota. So, our microbes that live inside our gut that work with our immune system, and how these microbes influence the immune system and whether or not diet affects them in any way. um, More information to share on that. Um, you know, and in addition to looking at diets and some exciting information that's out there, I think sometimes there's also some confusion as to whether or not supplements. So adding one particular nutrient in addition to what you're getting from food. Into the diet of someone who's affected, and if that has any benefit. So, a common question is whether or not vitamin D has a role. And what the data tells us right now is that vitamin D as a supplement to treat a condition is really not efficacious. However, the rheumatology community would agree that obtaining and achieving optimal vitamin D status is important. The role of omega-3 supplements is always a hot topic. And, there's a lot of good data out there in adult arthritis that says taking omega-3 supplements can be helpful at reducing symptoms. So things like joint pain and stiffness, but also maybe even disease activity. So this is looking at the inflammatory status of a person. Um, However, what becomes tricky in clinical practice is now knowing how much to give, what doses are actually effective, what doses are safe, and then complementing that with all the omega 3 that somebody might actually already get from their diet. uh, cur- Curcumin, which I often mispronounce. The active ingredient from turmeric is known to be an anti-inflammatory food out there, and lots of people are asking if there's a therapeutic benefit to taking it. The data is really limiting right now as it relates to disease control. Some data around symptom control is out there, but there's really no clear guidelines as to how much should be prescribed. And let me also clarify that uh, curcumin as a supplement is very different than using it as a flavoring or seasoning to cook and flavor dishes. The amounts that have been studied are encapsulated amounts, and they are significantly more than what usual recipes might include and the amount that a person might eat in their diet. So adding it to a diet is a great strategy, but the amounts that have been studied are much more. Okay. Glucosamine is something that a lot of people with osteoarthritis ask about. There's really, really no data out there in any of the other rheumatic conditions except maybe arthritis. And while it too is generally regarded as safe, there's no guidelines around dosing. And I bring that up over and over because dosing is important. Clinicians want to know how much and how often you're taking something because the thought process that let's just take more, it's anti inflammatory, having more is better is not true. That was actually shown in a few studies where patients with cardiovascular disease were taking omega-3 supplements and they presented to hospitals with overt bleeding that was associated with taking too much omega-3. So you want to be mindful and you want to be careful when you take these supplements that you don't just take more because you think it's helpful. Probiotics is a trendy topic. There's lots of conversations about a healthy gut and how to get a healthy gut and how that affects immune conditions. But I will say probiotics that have been supplemented in patients with arthritis, really no other rheumatic conditions, were not shown to be effective really at treating the disease. So again, looking at disease activity and looking at the symptoms associated with active disease. So there really needs to be a lot more research in this area, but that's not to say that we don't want to focus on a healthy gut and how do we get there. Um, this is a really important topic that I would like to also address because I think sometimes when clinicians talk about supplements, the goals of the supplement may not be clear. So while the last few supplements that I highlighted and personally selected based on questions I get asked, I'm sure there's more out there, I was specifically referring to whether they treat a rheumatic condition. I want to just share with the audience that sometimes patients, children, adolescents, adults with rheumatic conditions need a supplement to meet nutritional needs. So those are two very different goals. You know, I often talk about supplementing with vitamin D because I know it's really hard to get in the diet, particularly if you're not eating certain foods that are rich in vitamin D, which there's not a lot of other than dairy and some fatty fish. You know, we know calcium needs, meeting calcium needs for growth and development is not always easy through food and drink. And so supplement is of value. I can also say that sometimes not just toddlers, okay? It's not just toddlers that are picky eaters, but selective eating can happen across all ages and for various different reasons. Sometimes there's sensory issues. Maybe there's some negative relationships with foods that are out there, but you know, sometimes supplementing with a multivitamin or other specific micronutrients is needed when someone's not able to meet their needs from food. And piggybacking on that topic, knowing why diet, food, supplements are important is we know that patients with rheumatic condition are at risk of malnutrition, something that we also call poor nutritional status. Malnutrition has been reported in pediatric patients with arthritis and with lupus. Um, and I just want to highlight that malnutrition isn't just about undernutrition. So it's not just about people who, let's say, have TMJ involvement and are in a flare and have a difficult time chewing and swallowing food. But it's also about patients who aren't just growth faltering and losing weight because of these types of symptoms and issues. It's overnutrition. We do know that overweight and obesity is another health concern in Canada right now, and oftentimes these populations are forgotten. They're not thought to be malnourished individuals. And so I wanted to say malnutrition encompasses the whole spectrum of both under and over nutrition. And why does assessing nutritional status matter? You know, why do clinicians always want to know what are you eating and where's your weight going? It's because inflammation, which is associated with rheumatic conditions, can increase your risk of malnutrition. So, not eating as much, you know, you might have side effects secondary to certain joint involvements, or maybe certain inabilities to self feed, making it harder for you to get in the energy and nutrition that you need. We do know that if there's active inflammation, sometimes you can lose muscle mass, which affects your ability to mobilize and to be physically active, which is important to maintaining healthy nutritional status. Um, we also know with inflammation, sometimes energy needs go up, which means if you're not able to eat enough to get on top of those energy needs, growth and development may be affected. We know some medications affect your nutritional status, like prednisone, which is often associated with increased appetite. And then, if you feel hungry all the time and you're eating all the time, there's risks of overnutrition. Um, but in addition to disease activity and inflammation affecting nutritional status, if someone has compromised nutritional status, we know that that can also feed back to the disease. It can affect your symptoms, such as pain. It can affect how your immune system recovers, it heals. And I highlight here that in children and teens, especially, it affects your ability, to get into puberty, to grow, to develop, as well as it affects your quality of life and your mental health. So it's really important for everyone to know that eating for nutrition and maintaining nutritional status is just as important as focusing on eating and diet for treating the disease. And so, what does the evidence tell us? We always talk about evidence based guidelines and what's out there. And we can say collectively that there is some evidence to say that diet can help with treating rheumatic conditions like arthritis. Diets that are rich in fruits and vegetables, rich in whole grains, rich in omega 3s, limiting and preserved packaged junk foods, whole foods, things that look like the Mediterranean diet. And that's been described by researchers in the rheumatic community. It's interestingly also something that's advised if you're taking prednisone. So, prednisone is a medication that is good at doing what it needs to do, which is getting on top of inflammation, but it is associated with some side effects like increased appetite and challenges sleeping, maybe some changes to mood and behavior, and making food choices when you might be tired or angry. And these recommendations I put side by side because they're ultimately the same, focusing on achieving a healthy weight gain, real foods that focus on those fruits, those vegetables, those whole grains, and really limiting some of the things that are considered to be non therapeutic or non helpful, like red meats and saturated fats and simple sugars. And so when we talk about things like fruits and vegetables, I have to say in my practice, I rarely come across individuals who can't identify at least one fruit that they like. There's always one banana or one blueberry that's in the mix that, people can report they eat frequently and they can make a part of their diet. I find it's usually vegetables that typically, there isn't adequate intake in the diet of most individuals, myself included. All right, there are definitely days where I know I could have eaten more vegetables and I just didn't get there. We're all human, but it's really about globally thinking, how do we get more vegetables in? And I think some concepts and considerations that help with that are thinking about the season. There's a lot of chit chat about the Mediterranean diet and that it might be helpful in rheumatic conditions, but we don't live along the Mediterranean. I can't just walk out into my backyard and pick lemons from a tree. We've got to access our food in Canada primarily through food retailers and food industry. So it's about knowing what's in season, what's available, really using the fresh frozen aisle to get some variety. It's also about thinking about how we treat vegetables. Vegetables have a lot of texture and crunch and bite, and it's really about embracing the vegetables in that form. I often talk about please don't boil a vegetable like ever. Even when it's added into a soup, you can take sweet peas and throw them in frozen at the very end, and it's totally okay. But you want to consider grilling, frying, roasting, adding flavors to those vegetables, really using herbs and whether they're dry or fresh, and seasonings that aren't, laden with sodium. And even things like honey or molasses and maple syrup, and really being creative, getting inspired by the Food Network is usually where I start. But incorporating vegetables also onto your plate where they don't necessarily just look like a pile that's left for the very end that you kind of sort of toss around with your fork. Mix it in with your grains and your starches. A neat piece of advice that I got from a colleague was taking cauliflower rice and mixing it with rice when you make a stir fry or a side dish, incorporating it into layers, and just making sure that everyone around you is enjoying those vegetables all the time, not just isolating one person who has to finish their broccoli. Whole grains is also something that I feel like there's a lot of maybe confusing information out there. You take a cereal from the shelf at your grocery store, and it says a source of whole grains, and you think, great, I'm doing something good. But, not until you read the ingredient list do you see that, there might be whole grains, maybe somewhere kind of sort of ground up in there. And just for anyone who likes to know about what a whole grain is, it's really the entire part of a cereal or pseudo cereal that's included, as opposed to refined grains or processed grains, which have most often, like in wheat flour, had the germ and bran removed, meaning you've lost some good sources of antioxidants, micronutrients, fiber being that prebiotic, that thing that microbes love to feast off of and proliferate from and help create a healthy gut with. And so we talk about adding whole grains into the diet, but that does mean a little bit more legwork and learning about some grains that you may not be familiar with, i.e., even learning how to pronounce them, like quinoa, your teff, and learning how to incorporate them into your routine recipes. So casseroles, soups, stews, adding whole grain barley, which by the way is not pearl barley, but adding barley in with some wild rice, maybe some buckwheat, which is also known as kasha around the world, and using that as an alternative. And really, like vegetables, mixing it up into some of your good old fashioned recipes and learning how to be creative with them. In addition to your vegetables, your whole grains, one of the things that gets talked a lot about is adding more plant sources of protein into the diet, not just in the studies that looked at diet as a therapeutic option for rheumatic conditions, but also as part of healthy eating. And we'll talk a little bit more about some of the changes that Health Canada released in 2019 when they changed the food guide to healthy eating. But there's a huge focus in the medical community now for general health, not just for conditions alone, to really get excited about plant sources of protein. All right, so that includes grains, which we just chatted about, but pulses. So pulses is everything, including legumes, chickpeas, lentils, peas, and I highlighted peanuts because although it's called a peanut, peanuts nuts are actually a legume. They grow under the ground, okay, versus nuts, also known as tree nuts, they grow above the ground. Um, nuts are a great source of healthy fats and proteins that we sometimes forget about. I know for school-aged children, many schools are nut free, and so it becomes difficult adding nuts into the diet when we're talking about packing snacks and lunches. But it is something that can still be in the home. And for anyone that's out of, classrooms that don't allow nuts, it's a great thing that can be added to salads and yogurts and trail mixes to add extra protein to your diet. There's seeds as well. And then there's some other more trendier, I would guess, I would call them sources, such as nutritional yeast, which has a very tangy, earthy sort of flavor to it. Vegemite, for anyone who might have an Australian or New Zealand background and enjoys eating it, and spirulina or blue algae. And how does this all relate to kind of sort of what we as Canadians now are eating? As I also talk not just about eating if you have a rheumatic condition, but eating well. There is a Canadian National Health Survey that gets conducted in this country, and as part of this survey, we like to understand eating habits in addition to a plethora of other information. And so surveys are sent out and Canadians respond. And it's quite interesting. Most Canadians, at least half of us, think that we have excellent or very good eating habits. You know, but then as we start to dive a little bit deeper in understanding what it is that we're eating, when we honestly answer the question, we learned that in 2007 to 2014, the majority of Canadians were actually eating well below the recommended servings of fruits and vegetables every day. Average intake was 4 servings of fruits and vegetables. Keeping in mind, everyone, that serving sizes in Canada are quite small, okay, versus the 7 to 10 that's recommended for each of us to eat every day. As it relates to whole grains, in 2016, I believe it was, the survey was able to highlight that most Canadian children, teens, and adults actually do not eat anywhere near the amount of recommended whole grains as part of their total carbohydrate intake. In fact, about 64% of children and teens and nearly 60% of adults were anywhere between 10 to 20% of total carbohydrate intake coming from whole grains, which is a little bit different than what I think many of us would anticipate or understand. Um, in addition to what we have as part of our usual intake, our usual diet, one piece of information that I found fascinating that came out of this survey in 2019 was that nearly 23% of total daily calories for Canadians comes from snacking. Snacking, a concept that all of us talk about all the time. I'm feeling a bit peckish, I'm going to go for a snack. But one thing that I'd like to say is very, very different than treats. Snacking is a concept that I'd like everyone to kind of humor me on and think about snacking moving forward as a mini meal, not just a chocolate chip granola bar that you grab because it's convenient and it's there and you're rushing out the door to go to hockey practice, okay? But really thinking about this, nearly 23% of your total calories are coming from snacking. So obviously, if you're snacking a lot, you could be adding a lot more calories to your intake, which could result in overweight, obesity, but also to say that you want to be mindful about what snacks you're picking because that contributes to what's going in, what you're exposing your gut to, what you're exposing your immune system to, and how well you might feel. And so I briefly mentioned that Health Canada in 2019 released new recommendations for healthy eating. And they have this visual where essentially the recommendations are that half your plate, each plate of the three typical meals that you might have a day, breakfast, lunch, and dinner, should be fruits and veg. About a quarter of that plate should come from carbohydrates, where they're whole grain sources primarily, and about a quarter of your plate should come from protein, with again an emphasis on plant sources of protein. All right. A few of the other recommendations are obviously to eat whole, fresh foods more often, stay away from processed packaged foods as much as possible, and really learn to understand reading food labels in Canada. There's a lot of wonderful information available on Health Canada's website about that. It's very user-friendly information, so I do encourage everyone to check that out when you have some free time. Now, Canada's recommendations also align with what's referred to as a healthy eating pyramid, which is also very, very similar to, if anyone's ever seen it, a Mediterranean diet style of eating. And you'll see here that the top of the pyramid, which is the smallest part of the triangle, really emphasizes on what you should minimize. Those happen to be the same foods that increase your risk of developing arthritis. Back in that epidemiological data that I chatted about at the beginning of this session. So things like red meats and refined grains and foods that are rich in saturated fats, really, really reducing your intake of simple sugars, and focusing on, which is at the bottom of the pyramid, so what you want the majority of your diet to be rich in: fruits, vegetables, whole grains, and healthy fats. Oh, and obviously don't forget physical activity, which is important. But I know Cassie and Friends has had amazing sessions on that in the past, and moving forward always will. So I'll defer to those experts for that. And really trying to highlight yet again that we've seen this already. We've seen these recommendations. There seems to be a theme here, a lot of repetition, but a theme that I think is really important to tease out. And it stresses the opposite of what's now referred to as, unfortunately, the Western diet or the Western style of eating, which sadly comes from the usual and habitual intake of historically individuals from North America, hence the name Western, meaning Western Hemisphere. But now studies have shown is also a style of eating, and there's health associated risks in individuals that live in industrialized nations around the globe, first world nations, where there is less emphasis on eating whole, some fresh foods, and really focusing on maybe more convenient foods, sugar laden foods, processed foods, focusing on a lot of red meats, and meats is your proteins. And really all encompassing what is the opposite of what we want to encourage, and advise and recommend. Which piggybacks onto this whole concept of snacks and treats. Now, one of the things that I can say seems to be a challenge for many of us is trying to incorporate all of these great recommendations into our day-to-day lives. And I do have some advice and thoughts about that I'll share with everyone. But really, one of the things that I hope you take away from tonight's session is thinking about snacks differently. Really think about them as mini meals. So if you wouldn't put it on a plate to serve for a meal, then it's missing something. Snacks should really have two servings of fruits and vegetables and a source of protein. It's meant to satiate, it's meant to sustain, it's meant to complement meeting energy and micronutrient needs. And there's lots of fun ways of adding snacks into someone's diet, being a little bit creative and really straying away from those convenience foods and options that are there. Nothing against Costco, but sometimes you see those sales and you read those nutrition labels that are on some of the products, and you really think you're picking up something that's an ideal snack, but isn't. So I've provided some ideas here that I know children have told me they really enjoy participating in and making. Recipes are available online, and it's really for everyone to feel creative with, so let's not think about snacks as they are in the snack aisle at the grocery store. I took two pictures and I posted them. It's quite shocking, but there isn't one fruit, one vegetable, one whole grain, or really any proteins in that aisle. So really focusing on some fun ideas and active ways of incorporating healthy snacks into the diet. Um, and just being mindful of time and wanting to make sure that we do have an opportunity to answer questions that might be a bit more specific. Um, I think what I'd like to share with everyone is that there's successful ways of incorporating diets into your life. And one thing is to make it a priority. Make it a priority for everyone. We as caregivers and adults, we should be modeling behaviors that, we would like our children to grow up with and to learn from. So doing these things together and not isolating, I think is extremely important. You want to be prepared. You want to budget. You want to plan. You want to buy in season. You want to buy on sale. You might want to buy online. You definitely want to do batch cooking. Use your freezers if you have them. I live in a small apartment with just a fridge freezer combo, and it's my dream to have a chest freezer one day. So use that freezer. That way, when it is a busy work week or a busy schedule, you can just pull things out and heat them up. One of the things I love to do is I take my really, really, really ripe bananas and I make a banana loaf and I toast it and put some nut butter on it and, have a breakfast. But I'll make, 3 loaves because I'm already baking kind of thing. But you definitely want to do this together. You want to be all inclusive and you want to make it a priority. Uh, and just want to say you want to be mindful of it. You want to be present when you're not just thinking about eating well or following a certain diet because you think it might help treat the condition, but you want to be there every bite of the way, okay? Pun intended. Take your time, chew, slow down. Embrace it like infants the first time they've ever, sucked on a lemon. I love those videos that Ellen posts, right? You want to experience it. You want to enliven your senses. You want to enjoy it. You want to develop a healthy relationship with foods and your healthcare goals. Um, just some takeout messages for everyone this evening that I wanted to share. There really is some evidence out there that diet can help manage certainly arthritis and lupus, maybe even some other rheumatic conditions. Right now, it's mainly seen as adjunctive therapy. But we do want to help improve the quality of life of anyone affected with a rheumatic condition. So if it's symptom management, if it's supplements, keep an open dialogue with your rheumatology team, and see if you can get connected with someone who can help provide you with advice around healthy eating, which really is the Mediterranean diet and something that there's evidence out there for. Definitely advocate also for more research out there. I can certainly say the gluten-free diet and vegetarian diets are very popular questions I get asked about. There's limiting evidence right now, but some emerging and interesting data in non-celiac affected individuals. Very, very, very little data out there that doing multiple food eliminations is going to be effective. So be wary of that advice and just know the more that you eliminate, the more that you could be compromising nutritional status and quality of life. So serious considerations around that. So I hope that you all learned something tonight, and I look forward to be able to answer any specific questions and enjoy healthy eating together.
Thank you so much, Inez. That was really incredible and so much information. But I mean, I think what is lacking is just, there's that whole gap between like known to be helpful or helpful advice, and just like, I think parents just want to help their kids any way they can. And this seems like one of the pieces that potentially is in our control to do at home. And so I think the specificity that you provided around the information of what is known to help and what the evidence is, and just the general guidelines are really going to help so many parents tonight. And with that, I'm really excited to open up the live Q&A. And I'll just remind everyone that if you look below, you'll see a Q&A button. So you can enter your questions in there. And I really just encourage you, like, use this time, ask your questions. We're going to get through as many as we can live. But whatever we don't get through tonight, we're going to do our best to actually follow up to ensure that we can answer them after the webinar and post them. We have a nutrition section of our website under resources, which Inez has already done an amazing job putting together information. So you can find quite a bit of information after this webinar there. We're going to add to it with the Q&As that happen tonight. And with that, I think we'll just get started. So I was looking at all the, like, we've had quite a lot of questions that have come in on varying topics, but one that I saw that I just thought would be so good to start on is when we get a question we get a lot, and a question and also just a comment. Like, a lot of people have opinions on nutrition and they want to be so helpful when they learn our child has a rheumatic disease, and everyone has an idea or they've read something on the internet. So this particular question is like, how do I respond to the many people who believe that they can cure my child's disease with whatever diet they've read about or supplement they may sell? What is your advice to those parents?
Yeah, that's a great question. And I feel like that one is very difficult to navigate. And I just don't mean that professionally, I mean personally as well. I think people come from a place of a good place, a good heart, and they just want to provide you with advice. But what I tell patients is I say that without going into too much details about just how complicating rheumatic conditions are, I think it's just to remind anyone who's trying to provide you with the advice, which can sometimes be judgmental, right? Like, oh my goodness, you're letting your child eat cheese. Don't you know that dairy is pro-inflammatory, and that's probably why they're in joint pain? It's not so black and white. And if there's anything that the data that exists has told us, is that no two patients with the same rheumatic condition are the same. We have unique genes, we have unique immune systems, and we really don't fully understand or appreciate why somebody's immune system responds the way that it does. So, blanketed recommendations around diet to cure your specific or your child's rheumatic condition, I think, comes from a place of really not understanding just how complex it is. And it just speaks to why the research community right now that's looking at diets and supplements and nutrition have to keep doing more research. Is every time we learn a little bit of information about inflammation, there we go, that was a good slip up and segue, we realize that there's so much more to that story. And the blanketed recommendations aren't always helpful. And so to just loop it back and to bring it back to say, thank you, that's some great information and advice. I'll look into it. I'll also maybe take it back to my rheumatology team, and just, I think, not engaging in the conversation, particularly if it hurts you. And going to resources like Cassie and Friends, where there's reputable information, and information that, of course, is about efficacy, safety, and encompasses that quality of life piece as well.
Yeah, thanks, Inez. We try and do a lot of work just in raising general awareness about juvenile arthritis and other rheumatic diseases. And these are not just little kids with adult arthritis. And I think just, even just spreading awareness so that people understand the impact of these conditions on kids will go a long way to helping people, respect sort of the medical journey that people are on, as well as just, the adjustments they're making in their own
Yeah.
lives.
And I think the journey can be frustrating because there may also be people who have not only tried what they feel like is everything, but maybe are doing everything that I just presented tonight. And they're thinking, wow, I'm already doing that. That's great. But this is a bittersweet feeling because my child still has symptoms, or my child's rheumatologist still says that there's active disease. And I think that just identifies how complex. Autoimmune inflammatory conditions are, and it speaks to us also needing to learn a lot more to be able to help.
Yeah. Okay, so we're gonna get right into it. So
Sure.
we had a lot of questions about ferritin and iron levels.
Yes.
I think most of them are encapsulated in one question we got that tells a little bit more of a story. So I'm just going to read it out, and I'll see if anything else is missed. But first of all, the parent just said, "Thank you so much for organizing this," which just shows that this is information that's needed. And so, a 4-year-old who was diagnosed at 18 months with juvenile arthritis. So we haven't been able to get her iron stores to a good place. So her ferritin store is currently 11, highest it's been in ages. But do you think this is because of GIA? Because we know ferritin and inflammation levels are connected. She is on methotrexate, so that's another question about if that's something you see regularly. And there's one other question, but I'll save that to the end. So first,
Okay.
let's just really focus in ferritin levels. Do they increase with inflammation? How do we know if they're iron deficient or if they just have increased levels because of inflammation?
Yeah, this is also a really great question. And I think just to be fair to everyone in the audience, I hope that I can answer everyone's questions around sort of assessing for what clinically we refer to as iron deficiency anemia. And what complicates the picture for children who have rheumatic conditions is that we know when there's active inflammation that can affect not just ferritin levels, but it can affect the assessment around iron deficiency anemia. There's something known as anemia of chronic disease that can occur in patients that have diagnoses like arthritis, lupus, and other rheumatic conditions. So it very much is a back and forth with your clinical care team around assessing not just ferritin, but various different parameters that can inform your clinical health team about iron status. Because sometimes, even if your diet is an adequate amount of iron that's needed for growth and development. And sometimes, even when you take what we refer to as oral iron supplementation to treat the anemia, which is different than just a low ferritin. So I'll address that in a second. But even if you or your child are taking oral iron supplements to treat the anemia, sometimes it's just not enough. And different clinics may have different approaches with addressing that. I can say at SickKids, sometimes we do have to send patients to hospital to get intravenous iron infusions to help with the overall iron status. In terms of ferritin as what we call a lab value or biochemical indice, we do know that when there's active inflammation, ferritin is an acute phase protein, so it can also be elevated when there's active disease. But if someone's in remission and the level is low, it might suggest that you need more iron in your diet. So the best way to answer the question about ferritin is to not focus specifically on just that one lab value if you're thinking about overall iron stores and iron status, and to note the difference between being in a flare and not. And then speaking with your healthcare team about sort of the overall picture and what that means, because oftentimes there's more than just iron labs that are being measured. There might be inflammatory markers like CRP, SAR being measured, albumin might be measured, and so it's a more involved clinical picture. but that ferritin number on its own is usually not treated by itself. It's encompassed in a larger picture. And if your child specifically, who's just gotten up to a ferritin of 11 is a good thing, your rheumatology would know if there's anything else that needs to be done around that with overall iron status too.
Amazing. And the second part of that question was, do you have any tips for how to get my kid to take the supplements because they say they're very yucky?
Yeah, yeah. And I would say that I have tried many supplements over the counter and prescribed, both for personal and professional reasons. Working with children, which is a lot of fun, I do not want to come across as a used car salesman, you know? So I figure, let me try these things. Let me see what the pharmacist compounded. What does this taste like? You know, there are various different iron preparations that are available. Some of them are liquid for children that either have swallowing issues or if they're too young and little to take tablets and capsules. And those often are a thick consistency. They can sometimes stain the teeth. They can be yucky. Um, those iron preparations are called iron salts. Those are the irons that we often say don't take with dairy or calcium rich sources. Try not to take with any of the other minerals like zinc or magnesium. You don't want to take them necessarily with medication. So now you're probably trying to figure out in your day, how am I going to give the medicine and give the iron? That's already yucky. You know, we say take it with vitamin C. So what I've recommended for some families is you make like a little, this is going to be the wrong word, so forgive me, but a shot, okay? It's like a little vitamin C packed shot smoothie where you can put the iron in so that your child just takes the whole thing and it's a small volume, but the flavor's masked in citrus if they're okay with that flavor and the enhanced vitamin C. That seems to work, and then you know they get the whole dose down, and you can make it a smoothie using, I like to say like frozen banana to get that nice milkshakey smoothie texture, because you can't really take ice cream and make like a traditional kind of sort of milkshake smoothie. But I will say that there are other oral iron preparations on the market where you don't have to address all of that. There are ferric polysaccharides that are available. So a brand name that's available, I at least know in Ontario, it's called Ferrimax. And that supplement, you don't have to worry about putting it with milk, adding it into a yogurt, putting it into oatmeal, you know, mixing it into puddings, anything that you know your child would gladly take. You don't have to worry about giving it with vitamin C. It comes in powder forms, capsule forms, so it's easy to blend in. That's an alternative. There are heme sources of iron that are available as tablets that you could crush. They are bovine based, so for anyone who's vegetarian or vegan for personal, cultural, religious reasons, it does get sourced from cow. But that one I find you can crush really easily and blend it into stuff, because again, it's not an iron salt. So you don't have to worry about the vitamin C, the dairy, the spacing it out elements. And there's also ferrous bisglycinate, which is another iron preparation that could be considered. And if you're interested in any of those, I would say just go back to your rheumatology team to say, you know what, can we try another iron? I'm really tried everything. I have tried bribery. I have tried all kinds of textures and nothing seems to work, because taking that iron is important.
Right.
So we want to try to get it in.
So you mentioned dairy a few times in that discussion, and there was just one simple question, like, is dairy considered an inflammatory?
Yeah, and that's a question I get asked a lot, and I think it depends on who you might be speaking to. So not to dismiss, you know, any practitioners that work maybe in a holistic or naturopathic capacity, where dairy has been labeled pro-inflammatory and is often a food that is recommended to be removed from the diet of someone affected by an autoimmune inflammatory condition. Um, the data around what components of dairy make it, quote, pro-inflammatory aren't clear. And there are certainly individuals that have autoimmune inflammatory conditions that consume dairy, and it doesn't seem to affect symptoms or disease activity. So, for me in my personal practice, I don't label dairy as a pro inflammatory food, but I do tell individuals that if you are interested in removing dairy from the diet, I don't know if anyone noticed, but Canada's Food Guide to Healthy Eating now no longer has dairy as a food group. And that's just to say you don't have to have dairy to meet your nutritional needs. Of course, if you take dairy out of the diet, whether it's because you're interested if it has an effect on disease activity, or if it's just because you're like, you know what, I just don't like the taste of milk. Maybe I'll have some cheese sprinkled on pasta, but I really don't care for drinking milk or eating yogurt or, using butter in my cooking. Then you want to make sure that you're getting protein, vitamin D, calcium, vitamin A from other sources and meeting your nutritional needs. So the quick answer is the evidence around what makes it pro-inflammatory is not clear. It hasn't been shown to be a mitigator in inflammatory diseases. However, if it's something that you want to remove from your diet, again, mention it to your healthcare team and just make sure you're meeting your nutritional needs from other foods. Otherwise, it can cause malnutrition. It can compromise bone health, bone density. And it's for some individuals an important part of incorporating quality of life. So you really want to think about what that might look like.
Great. So another, and you said, so many great pro vegetable things, which we all love and work so hard to incorporate that into our children's diets. But then comes up the whole question of nightshades. So that's
Mm.
a whole family of vegetables that are often really palatable to big kids. But there's a lot of fear around whether those will cause an inflammatory response and what the correlation is between nightshade foods and the inflammation that our children are experiencing.
Yeah, again, likewise, another really good topic of conversation. So the nightshade vegetables, they come from the Solanacea family, which I think I've definitely mispronounced. I am not fluent in Latin, but they are potatoes, anything in the potato family, eggplants, tomatoes, and to your point, foods that I find a lot of children really do enjoy eating. I can say the evidence around nightshade vegetables is much more limiting. In fact, if you look at some of the diet studies that mimic or parallel the Mediterranean diet is rich in these, tomato being a fruit, by the way, fruits and vegetables that are considered these nightshade vegetables that you should omit. It's very limiting. And I often do tell families I don't encourage omitting them, particularly if a few of those like fresh tomatoes is a way to get fresh fruit and vegetable into your child, keep it in. Yeah, that one I would say super important. And then think about ways where, for example, if you feel like you're eating a lot of potato all the time, where you might be able to incorporate other starchy root type vegetables to create things like hash or a casserole or like a shepherd's pie. So don't forget that there's yams, there's taro, there's radishes, there's oh goodness, turnip. That's the one I was thinking of, not radishes. Radishes, wrong one. I had a moment there where I was trying to convert in Croatian and translate. But no, turnips you want to include, and sweet potatoes and yams, and there's so many other ways where you can get roots and tubers into the diet. And as long as you have some kind of blender or masher, you can be very creative.
Mhm. Okay, so now we're going to go on to sugar. Sugar. And actually, we have a great question that just came in that encompasses we had quite a few questions about sugar, but I think this one captures a lot of them. So, a couple of elements. So, her daughter was recently diagnosed last summer. She's 8. So, a couple things. One, they're cutting sugar out of the diet and the family diet. Um, Totally new to them, something they're trying, just wondering your opinion and if there's any ideas that can help with that. And then they're also asking, and a couple other people have asking your opinion on juicing. And a couple people have mentioned like green juices and celery juices specifically. So two things, I guess, sugar, and then obviously juicing can contain a lot of sugar. So both of those questions all into one. Go.
Okay, no problem. Um, I think one of the things certainly that for me I like to start with is a little bit of semantics and making sure we're all on the same page with terminology. I think sugar is one of those words that people also interchange and use a lot, but may not know what we mean when we're talking about either removing it from your diet or recommendations that are out there. So I've often been in the grocery store and heard somebody say, "Oh yeah, I'm low." Carb or something, I'm on a low carbohydrate diet or I'm on a ketogenic diet, and they'll talk about sugar, they'll talk about carbohydrate, but not really realizing what that means. So in nutrition in general, particularly in clinical nutrition, we talk about carbohydrates being a source of energy. About 50 to 60% of total energy comes from carbohydrates. And under carbohydrates, you have complex carbohydrates, which are like your whole grains, and then you have simple carbohydrates. So when we talk about sugars, we're talking about simple sugars. So things like obvious sources like candies and pop and chocolate. I also like to talk about things like corn syrup solids, high fructose corn syrup, which is pretty much in everything. Those are simple sugars. Those are the things that we strongly encourage that you want to limit in the diet, and that includes juice. So interestingly enough, Canada's Food Guide to Healthy Eating before used to say that a serving of fruit would be fruit juice. So everybody thought it was, hey, it's not such a bad thing. I'm just going to pack juice for lunch and I'm just going to have juice with dinner and we're just going to give juice in the morning because it's considered a serving of fruit. That recommendation no longer holds because it was realized that fruit juice in particular, and this kind of sort of addresses the juicing question, is that it's basically just simple sugars and water. So if we're talking about juicing, I tell families, you by juicing, yes, you're taking a raw, fresh fruit or vegetable, but a lot of the good parts, the parts that people think is what has the health benefit, the fiber and the prebiotic and the pulp and all of that gets removed with juicing. And what you're left with is primarily water with some simple sugars and maybe a little bit of vitamins, minerals, some antioxidants. So what I say is you want to take that juice and maybe incorporate it into a smoothie, where that becomes your liquid base. And then you can add some fresh frozen fruit to it, some protein to it, so that you can build some more nutritional value into that. So you're starting with the right concept, but you're not necessarily left with all that good food stuff that you want out of your fruits and vegetables, particularly if you're juicing frequently. Even some of the green juices, same thing, you're adding your kale, your spinach, with celery, those are all really, really popular things that are juiced. You still want the tough, rough stuff. That's what you want to be eating as well. And then in terms of going back to other sources of sugar, you really want to be aware of hidden sources of sugar. Look, glucose is important for all of us. Our brain thrives off of glucose. Children need glucose, but they can get it from sources that aren't necessarily corn syrup solids or high fructose corn syrup or some of these other really, really refined sugars that really provide no health benefit whatsoever. So it's about teasing out where you want to get your carbohydrates from and getting them from the whole grain and the whole fresh fruit sources as much as possible.
Amazing. Amazing. That's great advice. Okay, so we're winding up our Q&A and we have quite a few questions. So I'm going to ask a couple last questions and then I might just mention the ones we're not getting to, but that we will follow up with them after. And so quickly, gelatin. Gelatin, does it prevent joint pain or discomfort?
Yeah, so gelatin, I will say I'm not as well versed on. I think that falls into the same body of questions like bone broth, Okay, so for anyone who's not familiar with really what gelatin is, it's animal sourced protein, and protein can come from the meat, it can come from bone, and gelatin is actually used a lot in food industry as a thickening agent. But that's not what we're talking about, right? We're not talking about Jello or Surto or anything that makes that jelly kind of texture. It's gelatin on its own, and does it have a health benefit? That comes from some of the older evidence around people reporting that bone broths helped improve symptoms. And I have to say, the evidence is really limiting. But that doesn't mean it can't be incorporated as part of healthy eating. But in terms of recommending a certain amount of gelatin and that it has a therapeutic benefit, it's really not out there. There's no association.
Okay, so the very last question is for those families who don't have access to a dietitian as part of their rheumatology care, what are your suggestions about? There's so much that gets packed into clinic visits, and so many things to talk about and monitor, and medication changes and all of that in your child. But if you're concerned about nutrition or have questions, what is your advice in making that a part of your clinic visit, and approaching that topic with your pediatric rheumatologist?
Yeah, and that's a really good question because I would say if there's one thing that I've certainly embraced about working with rheumatologists is they certainly value the role of nutrition and they would love to have more resources. So from our end and from families' ends and from any organization that can, it's about advocating for knowledgeable, translatable, and important nutrition information because it's not that the teams wouldn't want to have that support. They just are unable to access it because it just doesn't exist, whether it be at that particular hospital or if it's in, a smaller clinic or private setting. And to that point, it's to say that, us as dietitians, we support each other. So while I'm not, full time with the rheumatology team, I do get to work with patients that are affected by rheumatic conditions. you know, I still support colleagues that work with me, and there's a whole network through Dietitians of Canada where there might be somebody that you can access to get that support. It just means that it might be an out of pocket expense. I encourage families to connect with their private health insurance plan. I know in Ontario, there's a lot more families that are getting these plans as the federal government changes sort of coverage models, and inquiring about whether or not there's flex dollars. So, taking the money that might be allocated for an osteopath or naturopath and then connecting with a dietitian, because maybe what you need is you just need that 45 minutes of getting your questions answered. It doesn't mean that you need to necessarily see a dietitian as frequently as you see your rheumatologist. So there might be some access through insurance providers, and some areas of employment, they have access through their HR to be able to connect you with services, some mental health services, allied health services where you can call and get some of your questions answered. In some provinces, I know in Canada, I'm sorry to anyone who's not from Canada, I can't speak to the rest of the world, but there are provincial telephone hotlines or email sort of type setups where you can have your questions answered. So that's usually what I tell families.
Well, with that, Inez, I just want to thank you so much for making this information accessible tonight to, 71 cities across Canada and internationally. And I think that this is such a great base to start with, as well as the resources that you helped us create or put up on CassieandFriends.ca. So thank you so much for your time tonight and all the information. And we will follow up. There were some other questions. There were a couple questions about JIA and IBD, and there were other questions that we'll follow up with afterwards, and we'll do our
Yep.
best to get them answered. But
And I'm happy to help answer them too. Absolutely. So I wanted to thank Cassie and Friends. This is clearly a passion of mine. I think that there's a lot of exciting research and opportunities to come. So stay tuned, because at least Cassie and friends will be able to share it, and we will stay connected. And thank you for everyone for joining. I hope there was some good information shared with all of you tonight.
Amazing. Thank you, Inez. So I'm just going to close with just a couple more words. Again, thank you so much to Inez. And also just to say that we have a lot coming up after this session. And this is what we're committed to doing throughout the years, to bring families information into their home. And these are the topics that families are asking us to cover. So following this event, you're going to get a survey, and we just want to say we really, really value your input, also your ideas for future events. So please do take the time. It's a short survey, and we would love your feedback. March 27th, we have a session coming up on methotrexate, which is a huge concern, of a very popularly used treatment in juvenile arthritis. And we have an expert from BC Children's Hospital who is actually doing quite a large national study as well, to talk about methotrexate. And then following that, and recognizing that tomorrow is Rare Disease Day, which we'll also be celebrating, we have a rare rheumatic disease talks coming up, which will cover some of the rare rheumatic conditions like juvenile dermatomyositis, lupus, vasculitis, and fever syndromes. So that's going to be a really special session where you'll be able to hear from expert speakers in your child's diagnosis, but then also connect with other families from across Canada, where you may not have an opportunity to do so at clinic. Again, we just want to encourage everyone to join our online support network, to connect with other parents. Whether or not you're looking for support, your experience and story is invaluable to others who are beginning this journey. And finally, one last thank you to our sponsors you see on the screen there. We are so thrilled to be able to provide these webinars and couldn't do it without their support. Lastly, if you have questions, ideas, would like to get involved with Cassie and Friends, we really, really are here for you. And please visit our website, cassieandfriends.ca, or email us at info@cassieandfriends. And if finally, with closing word, if you would like more sessions like this, and to support Cassie and Friends in our mission to transform kids and families' lives and to achieve a pain-free future for all kids with rheumatic disease, we always welcome support in the form of donations. So with that, enjoy the rest of your Saturday night. Thank you so much for joining us, and I look forward to seeing everyone at the end of March for our methotrexate session. Goodbye.